Taking action for you. Action News 5 at 6 starts now.
A growing number of monkeypox cases here in the Mid-South. Thanks for joining us tonight. I'm Joe Burge.
I'm Joy Redmond. While the illness is causing concern, experts are offering a little peace of mind tonight. Action News 5's Walter Murphy has this health alert.
That's right. Monkeypox cases have increased in Shelby County, but so is our county's ability to test for it. Now, the monkeypox test also not as invasive as those ones for COVID-19. You don't have to put the swab into your nose. You simply take the swab it over an open sore, send it off, and it comes back in 1 to 2 days with the results. Another thing that's different about COVID-19 versus monkeypox is the mortality rate.
We're not going to lose 1 million people in the United States like we have done with COVID.
While still a serious illness, infectious disease expert Dr. Steve Threlkeld says the mortality rate for monkeypox is still lower than with COVID-19. Threlkeld also saying the fact that monkeypox is not a new disease gives us an advantage that we did not have when it came to COVID-19.
I mean, we know a lot about this compared to COVID. We have everything in place to kind of do what we need to do.
Things like testing, for instance, more widely available for monkeypox compared to early 2020 when COVID-19 tests were scarce. And testing is something both Threlkeld and Dr. Michelle Taylor of the Shelby County Health Department encourage.
If you have a rash and you're worried that it may be monkeypox, or you know that you've come in contact with someone who has been diagnosed with monkeypox in the last 14 days, the best thing you can do is go to your provider and have them test you.
Vaccine supply for monkeypox is more of a similar predicament to COVID-19, but Threlkeld says the fact we aren't starting with a non-existent supply like we did when COVID swept the world is still a better prognosis.
The vaccine is still difficult to get right now locally. It's less difficult in those areas that have more vaccine and have actually applied for sort of emergency status. I think that's going to change.
How quickly, to be determined. But until they are, Taylor says it's important to listen to facts instead of fear.
Much different than COVID-19, yes. This is not an airborne disease. This is close, intimate contact.
Now, Dr. Taylor tells me they're still in the middle of contact tracing for those 3 new cases that are in Shelby County. We'll keep you up to date as information comes into our newsroom, both on air and online. But for now, reporting in the medical district, I'm Walter Murphy, Action News 5.